Today is September the 5th, 2025 at 10:30 a.m. and we are going to be changing a CVAD dressing, specifically a PICC line dressing. So at this point in time, we have looked in the computer and verified the order that this PICC line dressing change is a reoccurrent order in the system that is to occur every 7 days. And so we've done that, we've gathered our supplies, we have cleaned off our working area, our table where we're going to be working on. And so now I'm going to go into the patient's room. Hi, Mr. Picture. My name is May. I'm going to be your nurse today, and I'm here to change your PICC line dressing. And so we assume that the patient says yes, absolutely, come in. We go inside, we wash our hands, perform hand hygiene. We provide patient privacy, and then we bring our supplies with us that we have here, and gloves, and then we ask the patient about any allergies to any kind of tape or skin antiseptics. And so, Mr. Picture, do you have any allergies to any kind of tape or any skin antiseptics? And of course, we assume patient says no. So we proceed with our procedure. We explain that we are going to be changing the PICC line dressing using a sterile procedure, changing the dressing on his PICC line that is on his right arm in the brachial vein. And Mr. Picture is laying down in a comfortable position, so we assist him into a comfortable position where we can work on him comfortably. And with the PICC line, you want to extend his arm below the level of the heart. So, and then I'm going to go ahead and open my kit in my clean working area. And then I'm gonna go ahead and first put on a mask. So here's my mask, I'm gonna put it on. And then depending on the hospital or facility's policy, we would put one on the patient, or we would have the patient turn their head away from the site. So in this case, since Mr. Picture's PICC line is on his right side, we would have him turn his head to the left side, like so. So when he turns his head this way, like so, then we can proceed to assess the site and look at everything. So if there's any solutions, normal saline medication, anything that's running currently in the line, you would put that on hold at the machine, and then you would clamp the clamp to the line. So, but at this time, our current patient does not have anything running. So then I'm gonna go ahead, since we've done all that, I'm going to don clean gloves so that I can remove and discard the old dressing that is currently on his arm already. So first, I'm gonna go to the site and I'm going to assess the insertion site, where it's at on his right arm. And so you assess, do you have any pain, sir, when I touch it? And you note for tenderness, pain, or any discomfort while you're working on your patient. Then you go ahead and remove the dressing, so And when you remove the old dressing, you would be removing it and just pulling directly from the skin. But while you're doing this, as you're doing this, you want to secure the line so that you don't accidentally dislodge the line. So you would remove it from his arm, you throw it away in the proper receptacle that it's supposed to go to, and then you would also, again, remove your gloves that you've used to handle this, and again, remove and toss into the proper receptacle and perform hand hygiene again while you stay out of your sterile field. At this point, we've taken off the old dressing, it's exposed, there's no complaints of any pain, there's no tenderness, so I'm gonna go ahead and put on my sterile gloves. Okay, so now I have my sterile gloves on. And then I'm going to actually go back to my sterile field, and we're going to go through our supplies. This is the chlorhexidine wipe. This is the antimicrobial, and this is my alcohol. So go ahead and open. And then I would clean off any extra blood or like anything drainage wise that is on the site that I noticed. So clean that site all around. And you would want to go out 2 to 3 inches in circles. That's done. And then I'm going to go back ahead and grab the chlorhexidine. And then you want to also use the chlorhexidine at the site, and then work your way out. And go for a good 30 seconds and create a 2 to 3 inch perimeter around the site, outside of the site, like so. Discard the chlorhexidine, you allow that to dry, and then you would go ahead and take the antimicrobial disc. Some of them are round, some of them are square, and you insert at the site. And then once you do that, our kit should come with a skin prep to help maintain the integrity of the skin and to keep it sticky for the dressing, for it to be able to stick well and maintain good integrity. So skin prep, do not put skin prep at the site of insertion, but all around it. Okay, once we're done with that, we're going to go ahead and apply our clear dressing to the site. And you can lay it long ways, short ways, just depending on what works for your patient. Go ahead and do that. And then you want to take your measuring tape that comes with your kit, and then you measure from insertion site of the catheter at the insertion site to the end of it. Okay, that measures at 10 centimeters. Let's see. No, I'm sorry, that was in inches. So this way we do it, and it measures in 17 centimeters. All right, so we've measured, we've done all that. Now I'm gonna go back through, get my pen. We're gonna put today's date on there, what type of catheter, the size, my initials, and what we used. Peel that back, put it on the dressing, it's on there. And then once we've done that, now, depending on what it's got on it or the kind of cap, if your facility says to change your sterile caps while you change the dressing, then you would go ahead and do that. But you would remove the caps, take your normal saline flush, unscrew. You've already taken the caps. You would take, you can use an alcohol pad or antimicrobial swab, but you would scrub the end of your catheter for a good 30 seconds before you flush it. So scrub, 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 scrub. Once it's scrubbed and clean, you take the lumen and you attach it to your normal saline flush, and you would slowly push through to feel for any resistance or any sluggishness, and then you would aspirate and pull back to check for blood return. Once you've checked that and there's positive blood return, you go ahead and return that blood back and flush the rest of your catheter. And if your catheter has more than one line or more than one lumen, then you would do the same procedure to each one, cleaning for 30 seconds, then flushing initially slowly, aspirating for positive blood return, and then returning the blood and flushing the line. So let's say we have 2 lines. We've done both of that. We've checked, flushed, and now we're going to recap with clean, sterile caps. So now we've capped our line, so everything is now capped line. So then we are going to remove all this, and if your catheter has a stabilizer device, then at this point is when you would also go ahead and put the stabilizer device on your catheter to keep it secure. So that is it for today's video of changing a PICC line dressing following using a sterile technique.